Hello, my name is Jennifer Branes, and today I'm going to be answering 5 questions from the AOT prep course. So it will start like this. A client with rheumatoid arthritis is beginning to experience ulnar drift. The client enjoys cooking but is finding it increasingly difficult to use a knife to chop food. Which is the best intervention for this problem? There is 4 alternatives. A, instruct the client to use a knife with a built-up handle. B, instruct the client to raise the kitchen counters to place the food to be chopped closer to the shoulder. C, instruct the client to use a knife with a bent handle. And D, instruct the client to have the spouse do all the food chopping. So in this case, the correct answer will be C, instruct the client to use a knife with a bent handle. One of the most important principles for joint protection is to prevent positions of joint deformity. So in this case, an ergonomic knife with a bent handle will place the wrist in a hand-neutral position, reducing stress, but it still will allow the client to perform the occupational task, and in this case will be cooking. All the other options will be wrong. So the correct choice will be instruct the client to use a knife with a bent handle. Something that I thought will be possible is A is also built up handle will improve it up. It will not address the joint deformity. So that's why is a no for sure. And the other answers are for sure negative. So answer C is the correct. Next question. An OTR is working with a client who has a dorsal scar resulting in limited metacarpophalangeal MCP flexion of the fingers. When fabricating a dynamic MCP flexion spline, what is the correct angle of pull for a finger loop? So there is also 4 alternatives, A30, B60, C90, and D100. The correct answer will be C, a 90 angle of pull, because we want the pull to distribute to be most evenly to the proximal phalanx. So a 90-degree pull will distribute evenly to the proximal phalanx. A, B, and D, if the angle pull is greater or less than 90, the torque is less effective and skin breakdown might happen. Okay. Question 3. A client with a chronic median nerve compression at the carpal tunnel has a median nerve compression at the carpal tunnel has severely diminished functional pinch. In what position should the thumb be splinted to facilitate functional pinch? There is 4 alternatives. A, the thumb should be splinting in opposition and palmar abduction to facilitate thumb to tip prehension. B, the thumb should not be included in a carpal tunnel orthotic to allow for functional prehension. C, the thumb should be splinting in opposition and radial abduction to facilitate top to tip prehension. And D, the thumb should be splinting in extension to limit shortening of the extensor pollicis longus. So in this case, the right answer will be A. A is the thumb should be splinting in opposition and palmar abduction to facilitate thumb to tip prehension. A will be the correct answer. Another one that it was close but it was not good enough is C. The thumb should be splinting in opposition and radial abduction does not position the thumb for thumb to tip pinch. So that will be a no. And the other ones, of course, are no. Question 4. A student in the first grade has illegible handwriting. Results of a standardized assessment indicate that the student scored minus 0.5 of a standard deviation from the mean on a gross motor subtest and minus 2.0 standard deviation from the mean on a fine motor subtest. What do these results indicate? So there is 4 alternatives. A, activities to improve handwriting should be included as part of the intervention. B, the 98% of the students' peers will score better on the fine motor test. C, fine and gross motor skills are within acceptable range from the norm. And D, fine motor and gross motor skills are moderately delayed compared with the norm. So in this case, the correct answer will be A. Activities to improve handwriting should be included as part of the intervention. Standard deviations of more than minus 1.5 0.5 suggests the need for occupational therapy services. So more than minus 1.5 indicates the need. So in this case, the child will have needs for the fine motor, but the gross motor standard deviation does not suggest a delay because it was minus 0.5. So the fine motor should be addressed through an intervention plan that addresses the student's handwriting needs. The correct answer will be A. Okay. Last question is 5. An OT is providing intervention to a client with anxiety disorder who hyperventilates when faced with difficult work tasks. The OT asked the client about the client's successes and failure as a child and began to discuss how these early experiences might be the reason the client is experiencing anxiety at work. The OTR and the client discuss ways to manage these feelings. What frame of reference does this intervention suggest? So there is 4 alternatives again: A, cognitive behavioral; B, psychodynamic; C, cognitive disability; and D, behavioral. So we're gonna, I think, quickly eliminate C and D, and then we are between A and B. So the correct answer in this case will be the psychodynamic frame of reference because suggests and resolve a conflicts from his childhood that are the reason for dysfunction. And this is the base to treat all those traumas that he has from early on in life that are impacting now. The cognitive behavioral frame of reference works on the thoughts and reactions to the environment, something that is happening around him, but it has nothing to do with the past. So the client can identify triggers that cause anxiety and escalate through journaling and reflection. But in this case, that wouldn't be the answer. The answer will be psychodynamic because addresses unresolved conflicts from the past that are causing all this hyperventilation and stress. Well, thank you for your time.